medical aids, and health insurance packages. 5 options, as you can see. When you come to Alliance Health, it's all about options and all about minimizing shortfalls and co-payments. Yes.
Thank you.
Okay.
Thank you.
And in administering the fund, how much do you charge per dollar?
How much do we
collected? Yeah.
how much do we charge per dollar?
Yeah, per dollar
Well,
collected.
it really depends on the scheme. Like I said, we have
If I get
5.
If I get the best one.
This best one.
Yeah.
That one there is a bit of a gray area for me, but it can be answered. You will find out. Okay. Thank you very much.
We are exhibiting as the employer, the health service board. As we interact our stakeholders, both internal and external, they always particular questions that they come up with: what is the health service board? And also the issue of special medical allowance from our internal personnel, and also the issue of disciplinary and grievance procedures, which seems to be a problem with our members. They seem not to understand. And also the issue of recruitment freeze. So we highlighted that, and the issue from another person of a key population, that is about lesbian and girls. But anyway, we say that is a policy issue and should be handled from the top. The key population, guys, they were inquiring about what is the board, the ministry, doing to advance the interests of girls and lesbian. Girls
gays
and lesbian. Yes, they said when they go to our institutions, they face challenges in terms of accessing health care. So, but we are saying, okay, that is a policy issue. It's a handled with the Okay. So we are saying, okay, thank you so much.
That's good. So you're doing well.
Yeah, we are doing well, sir. Okay, sure.
Do you think, as the health services board, from your point of view, do you think you are effective?
Yeah, we are effective.
I think
And
that's what you should answer and tell us.
yeah, I think we are very
Are you an effective organization?
sure, sir. We are effective, and we have notable improvement that we've made for our members, in terms from doctors and nurses. Though there are still some
What have you
issues.
done?
We've for the past, from January to date, there were some conditions in terms of their remuneration which have been improved, though there are some distortions from other supporting staff. But anyway, we appreciate your office as the Honorable Minister, also for supporting, and also for the challenge that we have faced about the outbreak. We have been influential because of your brand you have created since your previous assignment, and we appreciate that. So the board also supports you, and even the activities of the ministry, we are strongly behind that, and we are sure we are going to achieve our goals.
No, that's good.
Okay.
I'm glad to hear that. I think the board is being. Good afternoon, everyone. Let me kindly ask you to just stand up and let's observe just 1 minute as we remember the founder of Zimafro, Dr. Timothy Stems, a former minister of note in health and child welfare at the time. And life always has to come to an end. It's acceptable. We can't run away from that. But the memory lives on. So just 1 minute of silence in remembrance of the great Dr. Timothy Stems. I thank you. Let's take our seats. I note, Dr. Sikosana, you identified the two board members. I've also noticed that there is a Professor Hilda Matarira here from the medical school, professor of note in chemical pathology. Good afternoon, ma'am. And naturally, if I want to start going around the room, I'll end up naming everyone, like Dr. Chirisa and everyone. Can I ask you to do something for me? Each one and every one of you. I want you to all say your names, yeah, at the same time. All of you. I want you to say your names. I'll count up to 3. And then you just say your name loudly. In fact, if you say it very loudly, then you are better off than everyone else. So, 1, 2, 3. Aha. So the deal is done. I don't have to go around and say, I also forgot so and so and so, forgot so and so. You say the names, and you are all very important. You are here because of Zimafro. And I welcome all of you. The management of Zimafro, I'm happy for the invitation. The last time I came here, I came as an invitee. How times change. I'm now coming here as the guest of honor and as the Minister of Health and Child Care. I was, last time I was with the Minister of Health at the time. Sometimes I forget that I'm now the new Minister of Health and Child Care. So here's the situation of how things change in life. Dr. Timothy Stems used to say to me, you and dialysis are inseparable. All the time. And he eventually named me Obadialysis. Obadialysis. You remember Dr. Timothy Stems, how very innovative, and he used to come up with all sorts of interesting statements, and I said one day I'll open a dialysis unit and I'll call it Obadialysis. So we were in the process of working on that, and he says, don't forget to invite me. I'm coming to officially open Obadialysis. So that great man is gone, but his memory lives on. I arrived into my position, my new position. I literally landed into cholera. And I saw the headline in one of the newspapers, Baptism of Fire. I think that was appropriate, wasn't it? That's what actually happened. Now we managed to bring cholera under control, but it's still temporary measures that we're utilizing to control the spread of the disease. We are looking at having the absolute and total solution, which is the water and sanitation solution to all our towns, to all our municipalities. Clean water, clean water, clean water. Quick repair of blocked drains, quick repair of blocked sewers. The system in Harare, for instance, Dr. Mungofa might know better, he was in the system. They've got parallel water and sewerage running in parallel. One pipe, water, the next pipe, sewerage. And the pipe works are about over 70 years old now. So if you get a best sewerage line, it bursts and it expands into the old water line. and then the fecal material seeps into the clean water. At the end of the line, you end up drinking your own fecal materials. So the system has to be changed. We can't keep saying that we've looked after the cholera cases, and then the next thing, the rains come again, cholera comes in again. We have to find the absolute total solution to the problem. And government is moving in that direction, and the new dispensation means business. And that is exactly what is happening. We were very timeous in declaring a national disaster so that we don't go back to the 2008 situation. So it had to be done. However, control of cholera starts with all of us at a personal level, personal hygiene. And we now have a mantra: cleanliness is next to godliness. Zimbabwe shall be clean again. And I cannot avoid asking you to repeat it after me so that it sinks in your minds. And wherever you go, your institutions, at home, I would like you to sing about that mantra. That cleanliness, repeat after me, is next to godliness. Okay, let's say it a bit more lively. And everyone, please participate. This is this. Cleanliness is next to godliness. Let's say it a bit louder. The gentleman there is not saying anything. You are not saying it. I would like you to say it, please. Let's say it one more time. Everyone, this is a serious business. 49 people have already died. And we are not supposed to have one single death from cholera. So let's take this seriously, especially us in the health sector. We are the one who must be leading the way. So let's repeat it one more time. I'll count up to 3 and you all say cleanliness is next to godliness. After that, you follow with Zimbabwe shall be clean again. Zimbabwe shall be clean again. Cleanliness is next to godliness. Zimbabwe shall be clean again. 1, 2, 3. Can I ask you to repeat it for the last time, please? Thank you very much. I'd like you to take note. I am greatly honored and privileged to be accorded this opportunity to speak as the guest of honor at this very important event, where I will be officially opening the 8th edition of ZimAfro Medical and Health Expo 2018, running under the theme Universal Health Coverage. Noted to my interest on day one's conference, which had sub-themes of innovative regulatory models, safe practice and quality, medical and health education. It is critical in light of the planned regulatory conference which discussed issues to do with innovative monitoring and control of practice in our health sector and standards of quality and safety within health and social care systems. Over the years, before I was the Minister of Health and Child Care, I've had the pleasure to participate at the ZimAfro Medical and Health Expo. And it is a great honor that today I'm standing before you to officiate this annual event. My ministry highly commends ZimAfro's efforts for creating a platform that brings together leading medical suppliers, distributors, professionals, health service providers, and related stakeholders to exhibit their products and services. As you have noted, the Expo presents an informative and engaging platform for delegates to learn and exchange innovative ideas and discuss key issues that affect the health sector. We also acknowledge the commitment demonstrated by our regulatory councils who have taken bold steps in supporting and participating at this year's Expo. Professional standards are produced by these individual professional bodies and other special interest groups. Professional standards often supplement regulatory standards, or they can be an alternative to statutory regulatory standards where no statutory regulatory body exists. For example, medical staff not currently regulated through statutory mechanisms, such as through the GMC for doctors, the Nurses Council, and the HPA, may not be supported by professional standards set by a professional body. As such, we expect this dialogue to continue and to have more participants as we progress, and urge all councils to attend this conference every year and discuss these issues and map innovative ideas for our health sector, which doesn't compromise standards and patient safety. Our government remains committed to creating an enabling environment for work and participation of all stakeholders, as evidenced by our support for the private sector players and in particular our support for ZimAfro. I want to applaud the efforts of the Office of the late Health Advisor, Dr. Timothy Stamps, for the support that they have given to this event over the years, which has become Zimbabwe's biggest premier medical and healthcare trade show. Dr. Stamps was on board partnering ZimAfro, supporting their endeavors. My ministry will try, by all means, to support this event as well, from where the Office of the Health Advisor left in creating a platform that brings together all these players in the health sector. My ministry acknowledges the rare opportunity that this Expo creates for us to meet with various stakeholders in the health sector. I also want to take this opportunity to thank the corporate world for their support in the fight against cholera. The government of Zimbabwe commends all companies, organizations, as well as individuals who have taken upon themselves to fight cholera, particularly those who are here conducting awareness campaigns. Indeed, you have shown us that we are in this together. Special mention also goes to the councils, NGOs, medical suppliers, distributors, professionals, health service providers, and related stakeholders who have made the 8th edition of ZimAfro 2018 a success. Your efforts are greatly appreciated. I was just hoping that I would have come across medicines manufacturing companies. I think we have to encourage them to also participate at ZimAfro in 2019. My ministry is working flat out to ensure that we get adequate supplies of medicines brought into Zimbabwe. At the moment, the levels are very low and are at a workable level. It is therefore necessary to also mention that the ideas that we have as a ministry is to completely transform the Ministry of Health. The delivery of healthcare in Zimbabwe has been lagging behind for a very long time, and we have to modernize our healthcare system. We want to create a system which is at par with any other advanced country, at par with the United States, at par with the United Kingdom, Germany, Japan, China. Therefore, it means that we all have to work together closely. It means that there has to be a lot of training of our personnel, a lot of encouragement of our medical councils to be able to harness all the relevant support, from the professionals who they administer or police, to ensure that everybody is working in one direction. We want our clients to have a very good or par excellence customer care service. Customer care is key to the production of an effective healthcare system. It is therefore relevant for us to have quality assurance programs running alongside the customer care programs. And we are encouraging our workers to embark on further education so that they acquire more skills, as we want to be able to create super specialist hospitals instead of having to send people to China, send people to Singapore. We want to have super specialization facilities where our population will be able to be looked at and get the best service locally. With ZimAfro, we also expect to see invitations going across the borders of Zimbabwe so that we can have such specialist services coming to display their wares here in Harare and be able to come up with links and build links which are appreciable so that our local specialists will be able to learn a thing or two and create exchange programs. The ministry, on behalf of government, would like to thank and acknowledge ZimAfro, therefore, for successfully hosting this 8th edition of ZimAfro Medical and Health Expo 2018. Last year, me and my institution, which was Chitungwiza Central Hospital, we won an award for being the best hospital in Zimbabwe. And I hope that those from Chitungwiza who will take over will continue and be able to continue winning that particular award, being the best hospital. But this time I'm now encouraging all hospitals to be the best hospitals in the region. So we all have to go in that direction and be able to provide the best services in the whole region. Provide high quality services for our people, for our citizens. Create a 5-star quality healthcare service for the benefit of the socially disadvantaged in the first instance, and ensure that the super specialist hospitals are also appropriately utilized by those who are in the upper brackets. I therefore declare this expo officially opened. I thank you.
Thank you very much.